on top of it, not only do you have to learn to recognize it, learn to accept that it's happening, and then learn that it's okay that it's happening, considering what's already happened to you, right? And then you have to practice communicating that to your partner. So we did the body scan meditation, and I would practice that with patients, sending kind and compassionate thoughts to every area of their body. So when we come back, we're going to talk about how body somatic interventions work. Bessel van der Kolk, in his work on trauma, one of the most important interventions that he did in his clinic and in his hospital was yoga. And that yoga moves emotions through the body. It gets you into your body. It's a moving meditation. We are going to go into the last part of our day. I hope everyone had a good break and got some pleasure out of their lunch. I just want to thank the Psychotherapy Networker, Pessy and Ryan, for creating this platform that we can reach so many of you. There's like 700 people showing up today or more. There was 1,000 yesterday, and there's 16,000 people signed up. So if each of you reaches one of your clients as a result of this and helps someone, I mean, that's an amazing amount of people in the world that we're touching their lives and maybe making a difference. I just feel really touched and honored to be here, and honored that you're here. And it's a very emotional. Somebody was saying, "How are you feeling?" I said, "I'm kind of traumatized by the trauma workshop," and because it's a lot of intense material, but I'm so incredibly grateful. I feel so privileged to be involved with therapists that are doing this work, and in so many different ways. I've really valued the questions. I asked Tim if I could get a copy of all the questions from yesterday and today, so I can go over them when I have time and really dig into the ones that I haven't had time to answer, and make sure that I include them in my next training, because some of them have been really specific, and I want to make sure that that's what's coming up for people, that I explore that and actually do the research of the things that I don't know. And I also want to get to know you. So if this is your specialty, I'd like to network with you and find out more about you and about the things that I don't know, because we need a community, right? I certainly don't have all the answers, and I would prefer us to work together as a team so that we can support the most people who need the most help. And the more we get to know each other, the better. I did give you a link to a listserv that's through my website. I don't know how else that we can connect with people. I've tried the social media thing. I just don't follow it close enough. I have social media. I have a Facebook group through my Integrative Sex Therapy Institute. I'm going to send again the way to join the listserv on my website. Any way that you reach out to me, I'll try to connect you with the group, with the community, so that we can continue the conversation. And at the end of today, we'll also talk about continued training so you can expand your knowledge of integrative relationship therapy. And let's prepare ourselves for a little bit more movement for the afternoon. And we're going to do movement and a little bit of writing and drawing. So be in a place, you can just be on your chair, you don't have to be on the floor, but I am going to share with you an exercise of chair yoga. Chair yoga was developed by Paul Denniston for grief and for trauma. He actually did a yoga experience for people who were frontline workers in New York after 9/11, and he developed this theory of chair yoga. I really love this, and I show it in all my courses. And if you don't know who Paul Denniston is, you should really check him out. He's fabulous. And he does grief yoga. And so he does these exercises where you can Do them from your office. You can do them with your clients. They're really amazing. So I'm going to give you just a short video where you can follow along in your chair if you'd like. What I love about this video and all of them is the implication that how we can explore with any particular form of grief or any particular form of loss or trauma. So I'm going to show you this, and of course, let me know if you can hear it.
Paul Denniston here. Thank you so much for joining. And thank you for just committing this time for you. I am honored to be your guide. When I created Grief Yoga, I really designed it for everybody. And I know that we all have injuries that we're dealing with. And that's why this chair practice is such a perfect space to allow us to transform the struggle. We're going to begin the class in just a minute. So find a comfortable seated position, find a chair, and choose to commit to 20 minutes right here, right now for you. And just begin to get connected to your breath and know that I am your guide in this practice, but connect to your intuition, your inner teacher, to allow you to know if at any point what I offer you physically hurts, then pull back and rest. But if there's an emotional struggle, then move forward with the sense of inquiry and what can you move through? Again, using movement, breath, and sound. And take a deep inhale and a deep exhale. Let's do that again. Deep inhale and deep exhale. Let's begin. And take a deep inhale through your nose and a deep exhale. Again, a deep inhale, still up, and a deep exhale. Now begin to just do a Suthi grind here, making large circles within your torso. And as you observe your breath, create space in the spine. Coming back to center, and now move the neck around, large circles within the neck. Moving in the opposite direction, large circles. Breathe. Now moving the head from side to side. And this can also be, what do you need to say no to in your life? As you stretch the neck, what do you need to say no to? Coming back to center, bring one hand to your opposite knee. Inhale, lengthen the spine. Exhale, twist. Come back to center. Bring the other hand to the opposite knee. Inhale, lengthen up. Exhale, twist. One more time on each side. Twist. Again. twist, and slowly come up to center. All right, we're going to release any tension right within our jaw. The way you do this is you grasp your palms right here and you inhale, and then just shake any tension in the jaw, just kind of like. You can make a noise if you want or not. I do. And inhale, and just shake any tension in the jaw. Good. Shake it out through the hands. Almost like you were just kind of like shaking out water. If your hands were wet, just kind of shake it out. And begin to tap your core a little bit here. Just kind of lightly tap your core. Bring your hands right over your chest with tight fists. And connect to what is the struggle or the darkness that you feel in your life, in your mind, or your body. I want you to hold your fists with dynamic tension. Connect to what is that struggle that you are facing in your life, something that is keeping you stuck. I invite you with breath of fire to equal inhalation and exhalation through the nose to spark the fire. Take a deep inhale. Now push both elbows back. Connect to your roar. Inhale. Exhale back. And again. Three more. Good. Shake it out. Move it through. Shake it out through the hands. It's a powerful way to open up right here within your throat, but also to connect you right here down to your core. Okay, this next exercise. Sometimes we might be really frustrated with the struggle and we want to know why this happened. Why did this loss happen? Why is this injustice, or why is there pain in the world? We might not always have the answer to it, but I think it's very important for us to express it, to move it through. And this is called releasing the why. And if you don't know what the why is, that's okay. Embody this. Things might come up for you. The way you do it, you bring your hands right up, palms facing forward, and you just say the word why. If you want to lift it up instead towards the sky, why? You can do that here. And begin to find it now at your own pace. Why? 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 Three more. Why? 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 Bring your fists to your heart. Allow any pain that you feel is inside of you, you're going to channel it and move it and flow it in powerful ways. You inhale and then push it out in front of you. Fists to the heart. Inhale, release. Inhale, let go. Three more. Good. And then just shake it out, move it through, move it through. Nice job. And hands out like wings, begin to move them forward and back. Forward and back. Heart forward, heart back. And just connect to how can you be compassionate to yourself in this time of transformation? How can you be kind to yourself? Where does love live in this space? Really allow the love to open up and back. Slowly coming back to center. I invite you to place one hand now onto your heart and allow the other hand to be at your side with the palm facing up. And now just flow with your own breath and see if you can just tune into your heartbeat here. And whatever pain, resentment, hurt, anger, struggle is weighing heavy in your life, when it starts to come up, I want you to acknowledge it, and just like your hand is letting it move beyond you, behind you, see if you can tune into your breath, into your heart. And now place that hand right here on the belly. May I be peaceful. May I be happy. May I be content. And take a deep inhale. And exhale, release your hands down. And in this space, we're going to embody almost as if it were like liquid grace. And I invite you to just dip your hands almost as if they were going into like holy water. And then you inhale and lift it up. And then just slowly begin to bless your mind, your body, and your spirit. And now keep moving. Inhale, elevating, lifting up. And then exhale, just bless yourself. If you want to in this, you can also just bless yourself with a couple of mantras here. May I be peaceful. May I be happy. May I be content. May I be peaceful. May I be happy. May I be content. I wash away the hurt. I wash away the pain. May I be peaceful. May I be happy. May I be content. Slowly bring your hands right down to your knees. Take a deep inhale and a deep exhale. Begin to move the knees a little bit here from side to side. And I invite you to place one foot over the opposite knee and slowly begin to fold right over that thigh and knee. And just begin to breathe. If you still want to connect to those mantras, may I be peaceful. May I be happy. May I be content. Do you want to take that foot almost as if you were bringing it inside for a deeper stretch? You can do that too. When you're ready, just release that foot down, ground it in, bring the opposite foot to that opposite knee. You're welcome to fold forward right over that thigh or knee. You can also pick that foot up if you did it on the other side and stretch the thigh. May I be peaceful. May I be happy. May I be content. Slowly coming back to center, bring your foot back down to the earth. And then bringing one foot over the opposite knee. Just squeeze those knees together. And then gaze over the shoulder and twist. Coming back to center, place that foot down. Bring that other foot over the opposite knee. And then twist from the other side. Slowly coming back to center. Bring your feet down to the earth. Slowly fold forward again as a bracing, almost like a waterfall, and just kind of shake it out through the head, shake it out through the hands. Slowly, one vertebra at a time. Take your time as you slowly begin to rise to sit. I invite you to place one hand on your belly and one hand to your heart. Just observe your breath as it flows in through the diaphragm and out. And allow the hand to see if you can hear the heartbeat. Tune in and listen within. And now feel your neck stretching up, and almost like a string is lifting your crown up towards the sky, and bring your palms together at your heart space. And take a deep inhale and a deep exhale. Just take a moment and observe how you're feeling different than you were 15 to 20 minutes ago. It's amazing when we just give ourselves a little time commitment to honor that mind-body connection. It creates space to lift our spirit. Like grief, it lives within you, and so does your love. And I am honored to have been your guide in this practice. And remember, this is a gift for you. You can come back and use it whenever you want. And if you have any questions, you can reach out to me at griefyoga.com. Thank you for letting me be your guide.
Okay, thank you. I hope you were able to join us and we're able to join Paul. I see a lot of hearts and um, a lot of thumbs up. I love that. It actually brings tears to my eyes every time. And I think about the different times that I've used it and for different reasons um, and the things that it's helped me to let go of and to appreciate in myself. And it's such a quick exercise, it's only 20 minutes. You can do it in your office with your clients. You're welcome to use it. You can even Google it. It's just Google chair yoga, Paul Deniston, or chair yoga for grief, or I can send you the link. He's happy to have you use it. So please continue to practice any kind of grounding technique that works for you. And I don't know, some of you are yoga practitioners, you are yoginis, some of you have been doing yoga for a long time, and this is not new to you. I mean, I've been doing yoga for many years, and I find that to have a yoga practice is wonderful. It's also not easy, right? So you need the discipline. And sometimes just doing it for 20 minutes in between clients is very healing. So thank you, Paul. And also, if you look at the Bessel van der Kolk research, they found that yoga significantly improved PTSD symptomatology as measured by the CAP scores, and it decreases the frequency of intrusive thoughts, nightmares, symptoms, and lowered the severity of hyperarousal. So we know that yoga is a really powerful intervention. Even if just in the session, as you're talking about, like really intense memories or fantasies, or if you're having issues in their relationship therapy, have people just get in their body for a minute. Like, just take a minute, take a breath. Can you put your hand on your heart, one hand on your belly? Can you stretch out your neck? I'm wondering if you want to just do a forward bend, stretch out your lower back, like anything that gets them back into their body with the control to know that we have autonomy and that we are in charge of our relaxation. It changes everything. Also, there's something about yoga that I think is so metaphoric. So in our culture, if we're in pain, there are a million drugstores, right? There's a drugstore on every corner in cities like where I live. And if you go down the aisles, there are aisles and aisles of painkillers. And if you go on the street corner, you can buy recreational drugs for pain. So the message is, if you're in pain or any kind of discomfort, go take something quick. Get out of pain. Pain equals bad. And many times pain does equal bad. It's a sign of danger. If you step on something, it's a sign like, stop stepping on that. If you touch a hot stove, it's a sign like, lift your hand up. So it's a sign of danger. It's important. Sometimes we get numb to that and we don't lift our hand off the stove. We stay in the relationship. We stay in the abuse. However, we also learn that we have to escape any kind of discomfort. Instead of, in yoga, we learn that growth means not running from discomfort, that if we feel some discomfort in our body, we actually take a deep breath and we stretch into that a little bit more, not putting our foot behind our head because our neighbor does it, because that would really cause pain and actually injury, but to stretch into our limits and past them. So we grow when we stretch past our limits, and then we learn to trust ourselves, and we learn that, I did stretch a little further today in yoga, and I feel better than I did last time. And next time I can stretch a little further. So stretching into the pain, being in the moment with the discomfort, I have control over that. And I learn that pain equals growth many times. And so it's a psychological metaphor too, that I can go into that pain instead of avoiding it, going circles around it, doing drugs around it. I can talk about my trauma. I can revisit it in therapy. I can explore some of the interventions that my therapist suggests. I can talk to my wife about it. I can go to the military support groups. Whatever the painful thing that it is that perhaps feels overwhelming. Maybe I could just push my edge a little bit. Maybe I can stay in the group for 5 more minutes. Maybe I can share with my therapist just a little bit more of what happened. So yoga works on so many different levels. There's also the metaphor of kintsugi, I can't pronounce it, kintsugi, the art of repair of broken pottery. Some of you know this. It's because of the internet, we all have this meme, but it's the Japanese art of repairing pottery with gold in the seams and making something more beautiful from it. So it's a great metaphor for, broken isn't bad. First of all, it's human. And when we put it back together, sometimes it can be even more of value, more valuable and more beautiful, more unique. We don't all have to look like the same bowl. In fact, it's our damage that makes us more unique. It's our repairs that help us to access our beauty. It's the depth of pain that's cut into us also allows us the vessel to hold more love and understanding. So there's a lot of ways that you can help people do that work of understanding that it's not about the avoidance, right? Again, another poem by Michael Xavier, who I love. They say love, like all good things, can only exist in the light. But what they seldom tell you is that hope, the best of all things, is born and grows in the dark. They say love, like all good things, can only exist in the light. But what they seldom tell you is that hope, the best of all things, is born and grows in the dark. So beautiful. I use this sometimes. Hope is born and grows in the dark. And that hope is continuous. You can lose hope and find it. It comes back on its own. You're welcome to use that. So I saw a question that wasn't addressed that maybe we can address today about something about the generational trauma of slavery, which I found fascinating and also very unequipped to answer, but I will try. And also the generational systemic racism that has affected us multi-generationally. And for us as therapists, I think it's important to begin to unpack this because it's institutionalized in our educational system, right? It's institutionalized from a generational perspective. So just a bit of interesting story of the ways that I can connect to it in my very limited, privileged way. When I was going to graduate school, I went to graduate school for art therapy, actually. That was my first degree, my first graduate degree. And I went to a college in New York. Meanwhile, my cousin, who's Jewish and a man, went to Harvard. And he majored in Russian law. So he went to law school, Harvard Law School, and he learned to speak Russian. And my grandfather, my mother's father, was from Ukraine. He's Ukrainian. So there was a huge celebration for my cousin getting into Harvard Law and for speaking Russian. And the big parties and, cards that went around the family. No acknowledgement at all of me going into graduate school for my little art therapy experience, for my non-Ivy League school. And that's just like a piece of the generational sexism in my family that has been passed down for, generations above them. I'm the only person in my family, the only woman in my family that went to graduate school. And the first woman in my generation that went to college and finished college, my mother went to nursing school. So in recognizing that, women were not encouraged to go to college, My mother was encouraged to meet a nice doctor to get married, and that's why she should go to nursing school. Um, the sort of systemic sexism I can somewhat relate to. Um, it's hard for me as a white woman to speak on some of the racism that's systemic in our public health educational system, but it's important to talk about. So, in recognizing that systemic racism has that multi generational effect, it affects our health, our wellness, and our resilience to withstand environmental or man made threats to our health. And that has been um, sort of a new realization in our educational system. So we have to recognize that structural racism is a public health crisis. And Michelle Williams, she was the dean of Harvard, said that we'll then have a framework, tools, capacity to develop roadmaps to address and correct and mitigate the problems that contribute to health disparities. We know that Black women die much more often in childbirth than white women in hospitals. They're given less painkillers, less medication in general. We've all watched on the news what's happened recently with the support or non-support of Israel versus Gaza in these Ivy League and college campuses. There's been a lot of protests, at least on both coasts, because those are the only coasts I'm familiar with. I'm not sure what's going on in the middle. But the institutional racism that's been brought to the surface around Judaism, if you're part of a system like a sect, there's been a lot of controversy around this topic as well. And it's affecting all of our systems. It's affecting every organization you belong to. And there is some generational concern here. I really want to address this question about slavery and how that's passed down through America and created trauma, and I will when we come back for questions. But I want to talk about how when we heal from trauma, it doesn't mean that you forget the experience or never again have the symptoms. So it's more measured by your involvement in the present. How do you show up based on the system that you grew up in, the system that your parents grew up in, the system that you grew up in, the country you grew up in, and by how well you regain control of your life and letting go of guilt and shame. And sometimes we can carry guilt and shame from generations back. And how do you work on the stress reduction skills? Are you doing yoga? Like, what are you doing? You know, I have clients that are ashamed and guilted because they don't comply with homework. And so they come to me from other therapists and say, you know, I just felt like a bad patient. And between us 16,000 people, 80% of your clients are not going to comply with the things you ask them to do, particularly couples. So it's great to give them home assignments, but most likely they're not going to do them. It's better to have them practice in the session, and then they have a transitional object to bring home. So it will remind them of the therapy, and they're much more likely to do it. So if you do the deep breathing in the office, they may deep breathe on the way home, and then they might do it when they feel triggered during their relationship conflicts. So do the things you want them to do at home in your office, not all the sex things. You can keep your clothes on, but give them the skills in the office. Mirror them. If they can't mirror each other in a couple session, you mirror them. You give them the skills there so that they can practice on their own. So what are the factors in successful recovery? Well, the degree of support, right? You know, if you have a family that only supports men, that only supports people who support them, like I have a couple of clients that there's a controversy. Maybe you can think about this yourself. They only feel supported by their parents or their sisters and brothers if they contact them, if they reach out. Their parents, sisters, and brothers feel like, no, you should call us. We shouldn't have to call you. So what is the message in your family? Are you supposed to call your parents if they're still alive? All my parents are dead. Are you supposed to call them, or are they supposed to call you? What is the expectation with your siblings? Are you supposed to stay in touch with them, or are they supposed to stay in touch with you? And so who causes the conflict and why? Um, Support sounds good in the speaking, but what is the price you have to pay for it? So, it's one thing to say, well, what kind of support system do you have? Oh, I have friends and I have family and I have a 12-step group. But what do you have to do to get that support? And what does that support look like? Well, I actually have to call my mother and then I have to listen to her yell at me because I haven't called her for 4 weeks. And then my father has dementia, so he doesn't really know that I'm there. This is a true story of a client recently. And then my sister comes over and she brings her kids and says, you never babysit for me. So I have support, I have family, but there's a price to pay. It's also very common in the narrative of one sibling being abused or more siblings being abused, and the sibling that voices the abuse being cut out of the family or being the black sheep of the family or being accused of lying or look, most of us have this, who have the same parents will have a different parental experience. So my sister and I had totally different mothers. She's 7 years younger than me. My experience with my mother is just foreign to her. Like by the time she came around, I mean, my mother was finally working days in the hospital's day shift, so she was home at night. When I was growing up, she worked 7 in the morning till 11 o'clock at night. She worked double shifts. And so she wasn't home in the morning, she wasn't home at night. My sister had an actual relationship with her. So our mothers were just totally different, our mother experiences. So the parent that you had is different than your sibling's parent. Now, if one of you was abused, sometimes the resentment is the envy. How come you got all the attention? Even if it was sexual abuse, you still got all the attention. There's a lot of conversation that has to happen around the generational support and the competition. And so redoing your self-concept, who am I now in my family? Who am I now in my system, whatever that is, in the school, in the college, in the agency where I work, in the city where I live? Like, who am I now in the culture where I place myself? Like, what is my capacity to identify myself? And then I really believe a successful sign of recovery is the ability to pivot. It's not so much resilience, it's the capacity to pivot. Like, okay, this way isn't working. I can pivot and do something else. I can figure out a different way. I can find another possibility. It's what makes you successful in business. It's what makes you resilient in a relationship, the capacity to pivot, and it's almost measurable. Like, how fast can you pivot? How quickly? I've seen it in my friends. Like, some of them can go, oh, okay, so wait, everyone has COVID that was at the party. Okay, so I'm gonna go get tested. We're gonna cancel that other thing. And then, you should really stay home and not be with it. Like, they just do it like bam, boom, boom. Now, some of them have had trauma. Some of them are resilient in that way. They're just like planners. Other people still have like the freeze response. What do you mean there's COVID at the party? What are you talking about? And then there's an anger response in some people. Who brought COVID into the party? Like, whose fault is that? We have to find out who was the ground zero there. I think out of all those responses, all natural, normal responses to trauma. And sometimes the pivot person doesn't respond till later. Pivoting could be just an initial crisis response, like they're really good in a crisis, but later on they get upset or angry. But pivoting is definitely important in successful recovery. And then the capacity to access professional treatment, again, could be a privilege, or medical help. And then your involvement in the justice system will determine whether you have successful recovery, because once you get into the justice system, many times you can be re-traumatized, right? So being arrested, being in prison, being rearrested, trying to recreate your life after prison, a whole trauma situation in and of itself. I don't work with perpetrators, but I have supervised people who work with perpetrators who get stuck in that justice system, have a hard time getting out. And for those of you who are doing that work, I am sending you lots of little hearts. So building affect and sensation tolerance, if you're having a feeling like right now, when you think of getting COVID, let's use this as an example. Like, oh my God, what do you mean? We all just got home from this party and there was COVID there. That sensation, just notice it. Like, do you start to feel anxious? Do you feel it in your body? Do you feel nothing? Do you feel like, well, I already have COVID right now, so it doesn't matter? Like, what are you feeling right now in your system? And then can you use your breath to breathe through it? Like, okay, I feel it. I'm a little worried. Oh my God, we're going to end up in the same place we were. My husband's going to be back in the hospital. I'm going to have to like cancel all my appointments. I'm going to have to go into emergency overload. I'm just going to breathe. Just take a couple breaths. Breath brings you back into the moment. And are there movements that can support that feeling of like, okay, just be in the moment, be in the moment. I can put my hand on my heart. There's things that I can do. I can find the support in my body that I need. What can you do? What's helpful to you to get you through that feeling? Maybe it's drinking a ton of water. Like that's the movement you need. Like go pour myself a big glass of water. That's going to help. What can you say to yourself to help with this feeling? Like, okay, I'm just going to go get a COVID test. It's no big deal. I've had COVID 4 times. I've been vaccinated. It's just like a cold. I'll be all right. What could you do to ask your partner to help you with this feeling? And it's not go ask your partner. It's can you imagine that your partner could help you? What would you say to them? What would you ask them? If you don't have a partner, what about other people? Are there other people that support you that you could call and say, oh my God, there's COVID at this party and this is how I'm feeling. And then what is the part of you inside that is jumping up and down saying, I have a feeling, pay attention to me. There's something going on with me. I'm freaking out. You know, because I grew up with a nurse as a mother, I mean, you had to like lose a limb to get attention if you were sick. It was like, okay, you don't have cancer, so you're fine. And the, you know, the fever, the flu, the whatever, it was like, stop complaining, put your shoes on, go to school. And so there's a little girl inside of me that is afraid if I'm sick that I'm complaining too much and I'm whining and what's your problem? And there's people that are so much sicker than you. And I've had family members that have died of cancer and what, you know, don't be a wimp. Like that's a little part of me. And I have to address that fear that, you know, if I minimize my sickness, then I won't take care of me. I have to take care of me. So I have to pay attention to that part of me that wants to avoid it or feels ashamed of being sick. So is there a part of you inside that gets emotional around thinking you might have COVID? Do you have a trauma response of like, oh my God, I remember when we were in lockdown and that reminds me of when I lost my home or when I lost my job or when I had to homeschool my kids and I couldn't do algebra. Like, what is that part of you afraid of? And talk to them. Talk to that little boy inside and say, you know, I get it. Algebra sucks. And that was a rough time. And, you know, we all went through hell during that. And what can I do to help you now? Like, can we talk about if that ever happened again, we get a tutor. Like, what can you do to talk to that little part of you inside? And that's an ongoing journey, right? That's an ongoing journey. Why? Because at least a quarter of these cases are chronic and they are resistant. That's what we're talking about, the sort of tough cases, the resistant cases. And resistant makes it sound like it's a choice, right? Like, well, I'm in therapy, but my therapist isn't that good, or I've been working really hard as a therapist, but my clients are just not compliant. They don't listen. Like, it's not a choice. PTSD is It's a response to trauma that creates coping skills that can be permanent. So we have to keep that in mind, that they were very beneficial at the time and they're hard to change. Now, some of you are asking about EMDR, eye movement desensitization and reprocessing. It's the eye movement trauma process. Most of you are familiar with it because you're familiar with trauma. That's actually 90% effective. So I've had EMDR myself. I found it very effective. I think, at some point we'll all be trained in EMDR. It's not easy to go through EMDR. It really brings you to those places. For those of you who are EMDR trained, if you're on my listserv, and I'll show you how to sign up again, please tell us who you are and where you're located so we can send people to you. There's some confusion about whether or not you can do this on Zoom or do it online. You tell us what you do. If that's something you can do online with a light bar or whatever, tell us. And because we need a referral base for people that are consistently working. And then tell us who your preferred clientele is. If you were a religious therapist, tell us that. If you're working only with couples, tell us that. If you're working with people in open relationships and polyamory, tell us that. If you're working with kinky and BDSM clients, tell us that. We need a network. So, there are a lot of EMDR trainings around, and we can also give you that resource if you'd like. We also know that group therapy works really well for trauma for the obvious reasons of community, connection, sharing, being vulnerable, learning to be with other people, learning to trust, learning to have empathy for other people, trusting that you can share your experiences, also being in the present. A good group therapist is not someone who does individual therapy with each person. It's hard to do group therapy. I know I did it for years. And you have to be able to really use the present. So it's a smaller version of your larger life, right? So you're capturing how you act in your regular existence in this 2-hour session. So if you're hiding in the corner and you're not making eye contact, that's probably how your folks are doing in their regular world. So as a group therapist, you have to be able to understand those dynamics and confront them and use the group members to do that processing so you don't have to do it. And you really do have to have the training. It's very important to have good complex group therapy training. And maybe someday we'll do that training here. So part of the cognitive behavioral therapy that's at the core of sex therapy, it's at the base of some of the trauma therapy, is really challenging yourself. So what's the evidence for this thought? And are there other thoughts that might be more helpful? So I'm going to ask you to do another journaling exercise. If you could take out a piece of paper. And what I'd like you to write at the top of the page or wherever you're on the page, if I had no fear or negative emotion, what would I be doing with my life right now? If I had no fear or negative emotion, because sometimes we identify negative emotions personally. So your negative emotion, my negative emotion might be different. If I had no fear or negative emotion, what would I be doing with my life right now? And I just want you to free write without picking up your pen for the next 3.5 minutes. Go. I'll tell you when we're done. Okay. So if you'd like to, if you're brave enough and you want to put one of your answers in the Q&A, I would love to see it. No worries. I just got a text from my daughter saying she finally tested negative from COVID. She's had COVID for the third time in the last couple of weeks, and she's doing much better. I'm very happy about that. Thanks for the thumbs up. So if you were less fearful, if you had no fear or negative emotions, what would you be doing with your life right now? It's kind of like this third part about challenging the evidence. If you were less fearful or negative, what new emotions would come up? That may have brought up feelings, what you just did. Like, if I had less fear or negative emotions, I would probably take some solid time off and finish my memoir. But I wrote that and I was like, is that really true? Like, I'm really trying to challenge that thought. Like, what's the evidence for that? Do I really want to do that? Would I do that? Would I be okay with that? And I started getting a little anxious, like, I don't know if that would be fun. What would I do? Like it brought up some stuff. So what did your no fear vision bring up for you? If it brought up fear, it should have, because it's the opposite side of no fear. But it's a good way to challenge your brain about the decisions that you make based on fear or avoidance. So, what am I actually trying to avoid? Is it time with myself? Is it time where I don't have that pressure of overwhelm of doing a million things at once? And if I don't have a million things to do at once and I have to face myself, like, what am I afraid will come up? Like, those are the questions that I'm imagining I'm asking. Part of what people's fear response many times is when I ask this question is that they would tell someone what really happened to them, which is kind of what I just said. Like, if I had no fear, I would really write my memoir, which is kind of like I might tell people really about my truth. And according to a survey, over half of women who've had sexual assault in their life within the last 5 years have never told anyone. And it goes to a cultural message about shame. It goes to a cultural message about, like, don't tell. It must have been my fault. I must have deserved it. I must have done something. How will people treat me? How will my life change? I'll have to go through the justice system, which doesn't really provide justice in most cases. You know, it's better just move on and try not to think about it. I mean, that's really the cultural message. And how do we as therapists handle that? Because some therapists, it's interesting, if somebody tells about their sexual assault in the session, they're immediately like, okay, we have to report this. You're going to fill out the police report. You're going to go to the blah, 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 blah. That works really well for some people because it feels like you're advocating for them. For other people, it shuts them right down. Like, okay, I'm never going back to you again. I can't talk to you about it. You're betraying me because I told you something in private. I don't have an answer for that because I know that it works differently for different people. And it depends on who you are. So I have an exercise that I do with people, an I am exercise. You write down I am 20 times. This is a poem actually by a trainer in the psychedelic field. She wrote this poem, and she did I am from, and it's called I am from. She said, I am from a 2-generation family. I am from a household with many rules. I am from a regime filled with mistrust, fear, and suffering, as well as deep and vulnerable relationships. I am from a sibling relationship, the older one. I am from the land of pine trees, birch trees, and weeping willows. I am from the land filled with berries, apples and pears, cherry trees. I am from the land of rivers and ponds, forests filled with mushrooms and herbs. I am also from a faraway galaxy. I am from a place of love, compassion, selfless care, and joy. I am from many lifetimes of healing traditions. I am from medicine healers and medicine women. I am from my beautiful teachers and my logical family. I am from the level of those I am traveling with today and traveled with for lifetimes. I have done this with people who are from and feel um, self-care is and honesty is a challenge. So this is from someone else. I am from self-loathing to self-care. I am from the daily practices that lead me to feel embodied. I am from nature. I am from being highly sensitive and culturally never enough. I am from ceremony and the perfect dose that told me I am enough. I am from yoga, breathwork, mushrooms, vines, therapy, and triggers that have brought me to my knees over and over and over again. To cry for Syria, cry for war, cry for shame, cry for all the times I have escaped myself. I am from every herb I have ever prescribed, foraged, and cooked. I am from every piece of plastic I have put in a landfill. I am from the earth screaming for our attention. I am from Mother Earth abundantly available for whatever we are letting go. I am from the rot to ripening, the compost of hope that if we live, we must die. I am from the inevitable realities of existence, bleak and beautiful. I am from the suffering that makes it bleak. I am from the art that makes it beautiful. It's amazing when we write without expectation or make art without expectation, when we explore without fear. So telling your story about your assault is different than telling someone who you are inside. I'd like you to take a second and appreciate yourself right now. So in your journal or on your piece of paper, I'd like you to do another exercise. It's an appreciation, just like the one that I do with clients, that I do with couples. I'd like you to write down 3 things that you appreciate about yourself right now. About this moment right now. 3 things you appreciate about you, or 1 thing you appreciate about yourself, or 1 intention you want to set for the work. So I'm sorry, that was confusing. 3 things you appreciate right now. It could be about this, it could be about the train, it could be about your life, it could be about the earth, it could be about anything. And then 1 thing you appreciate about yourself, which I think is the most important part. And then 1 intention you want to set for your work going forward. So 3 appreciations, appreciation for yourself, and an intention you want to set for the work. So go, set the timer. Okay, stop wherever you are. I hope that you included an appreciation about yourself. If you'd like to put it in the Q&A or the chat, you can. I think Tim prefers a Q&A. Also an intention that you have for your work, you can share that with us too. So I talked a little bit about BDSM, bondage, domination, sadomasochism. Somebody had asked a question about it, that people who enjoy that or that lifestyle are more drawn to the kinky lifestyle. It's because of trauma. And I said I would give you the link to the study. So that's in your handout, that they surveyed over 700 practitioners and 500 non-practitioners from the general population who said that that wasn't true for them. Now, like I said, it's a limited population. So I don't know if that really represents everyone, but it certainly is a good look into the lifestyle. And the difference between passion and addiction is that between a divine spark and a flame that incinerates. Some people were asking about sex addiction and BDSM and the hypersexuality of hyper pleasure experiences. Some people need more intense experiences after trauma. That is absolutely true. I will go out on a limb and say that that is the case. The compulsivity of that is different. So being compulsive about it means I have to continue to do it. It's the only way I can receive or give pleasure. And I can't stop doing it, even when it's not convenient in my life or my lifestyle or my relationships. So even when it's not good for me or my partner, I have to do it anyway. And that's the difference. If it becomes compulsive and affects my life negatively and I have to do it anyway, then it's problematic. Then it's a flame that incinerates. And it doesn't necessarily mean that it's bad for everyone. And sometimes it can be anniversary connected. So, sometimes during the anniversary time of the trauma, the hypersexuality can be escalated. So, this one couple who goes to the BDSM dungeon every February 25th, because that's when the trauma happened, might be a reenactment, but for them it might be healthy. If they were going every month on the 25th, that might also be okay if it was okay for them. If they were going every day to the dungeon, it might not be okay for them. So it really is up to them. I want to stop here and take some questions. It really is up to them, like what works in their particular relationship and what doesn't work, which is sometimes more important. If you had no fear, what would you do? Would you go to the dungeon every day, or would you stop going to the dungeon so that the feelings could come up and you could get in touch with them? I think this is a good time to take some questions.
Yeah. I think as I look at the first question, it really continues down what you were just speaking to. So can a sexual addiction be an attempt to override trauma pain with pleasure? And if so, how would you work with a sex addict who views any form of self-pleasure as addictive or part of the sexual addiction process?
Yeah, so I think I answered the first part, but the second part is like, how do you work with that? And I don't call it sex addiction. Because it's not a diagnosis in the DSM, but I do recognize that there's out of control sexual behaviors that are compulsive and not helpful. And so we try to tease out like what part of this is related to your trauma, what part of this is healthy for you, what part of this is related to a reenactment, and what part is got negative consequences. So the negative consequences mean that you do it regardless of the fact that you're going to lose your job or lose your relationship, or it's hurting your health. So just like any compulsive behavior, you can look at it symptomatically. I would also get some supervision and a consult about it, because sometimes we can pathologize sexual behavior that is not within the norm. And if it's outside of our experience, sometimes therapists say if a couple is having not, or an individual's having not enough sex, then we should like help them with their desire issues. If they're having way too much sex, then they must be sex addicted. So it's good to work with a consultant to say, is this my stuff or is this really happening? 9 times out of 10 it's probably really happening, but it's really great to be able to see it from a variety of lenses.
Yeah. This one's from Kathleen. She's asking a little bit different dynamic, I guess. As if as we grow older, if we and more knowledgeable, if we realize that we've traumatized our own children, how can we help them heal? Really speaking to the adult child, even if the adult child is saying, "You did a good job, it's fine, I'm fine."
That is such a tough question and so heartbreaking for me. As someone who went through a divorce and feels like I traumatized my children. I remarried when my kids were young, so they had a good relationship with their stepfather and their step siblings, and they all grew up together. And so I convinced myself, I talked myself into, it was better for them. They were healthy and they grew up in a healthy family and it was loving. And but that doesn't take away from the effects that it had on them growing up, that I divorced their father. Everybody has their karma. Everybody has their world that they have to grow up in and that they have to heal from. And I've been putting money in their therapy fund since they were born. So I'm really hopeful that they will take care of themselves. And my daughter just graduated from college majoring in psychology. So I'm assuming that she's working on her own stuff. And actually, in many ways, she's much smarter than I am. God, she is like really bright. Like her generation is really on it. And she can just go right to the heart of the matter. So I know that she's working on her stuff. And to be honest, she has confronted me about things that I've done in the past that were not good for her. My son is not quite as vocal and insightful, but more that it's not that he's insightful, that he keeps things to himself. So I'm speaking from my own personal experience. I don't have any knowledge or research to show you what to do for what you've done to your kids. The only angle I can come from is human to human. So I would, again, get some consulting. I would get a supervisor. I would find out from someone who's much better at this than I am what to do. And I'm just sending you little hearts.
Yeah. Question from Brooke. When you're working with a couple, it becomes apparent they are not going to be okay to stay together. And then they may even see it too. Reconcilable issues, sexually or otherwise. Do you have advice on helping them not to stay together?
Yes, I have a lot of actually trainings on, divorcing with integrity and separating with integrity. I think one of the challenges of being a therapist is letting them know that you're not going to abandon them if they decide they're not going to stay together, that our vision of success is not just having longevity in your relationship and maintaining monogamy. If we did that, then we'd fail over 50% of the time because people don't stay together. So, I know that a lot of our LMFT histories and stuff have said, the relationship is our client and we're working to keep them together. And that's great. But if they're not going to stay together, we can still help them and help them do it in a way that keeps them relational, because they're still going to have a relationship. It's just going to be a different relationship. And particularly if they're going to co-parent, I think it's really important to tell them, I'm happy to continue to work with you through this so that we can have the best divorce possible, the best separation. You can learn how to co-parent. You can continue to communicate. This can be one of those better transitions. You can be part of the solution as the therapist of like helping the culture shift from, that's a disaster and I can't see you anymore and I'm firing you. Now you're on your own to figure this out. To, no, I'm your support system, so I want to help you through this as well. I mean, I think that's crucial. And I do think we need more training. And Bill Doherty does some training in this as well. And but there's not enough. So that's my short answer to a longer question.
Right. And maybe I can say, I know one of the things I appreciate about your approach is how intentional it is on the grief process. The grieving, you had this idea, but now new life looks like this. I don't know if it's worthwhile to speak to that a little bit in terms of just, the grieving that's becomes part of the entire healing process.
Yeah, actually, the divorce work that I do, I call it intentional divorce. I think being intentional about any of these processes is part of integrity, living in integrity. It's like, okay, I'm going to honor and welcome in the part of you that maybe doesn't want to stay together. It's not that I only welcome in the part of you that wants to stay with your partner. Like, let's welcome in all those parts and talk to all of them, have group therapy, and figure out what's the best for you. Um, it's like welcoming them all into this foreign land, and how are they all going to live together? All those parts, in order to be liberated from our own fears and traumas, we have to let them all in. Our natural proclivity is to try to shut them out, to compartmentalize, to dismember, to dismantle, to hide, to put them in the closet, to deny them, to take them, those chapters out of the history book, to change the history, to pretend things aren't happening. And this focus is really about, the goal is living in integrity, which means opening up, being transparent, being honest with yourself first. And sometimes that's the hardest part. I'd like to go back to that slavery question if we could.
Sure.
I don't know if I can answer that, but it was about drapetomania, and it was about, I copied it down. It was about enslaved Africans who were seeking freedom there, and residual trauma. And I don't know who wrote it, but I do know that if you can't find, I'll give you a minute. But drapetomania or darpetomania, I forget how you say it, but it was a false pathology. It was like a diagnosis that they gave slaves in the 19th century, and it was like the way to explain this uncontrollable urge for freedom. So it was a way to perpetuate, whipping and punishment for people that wanted to escape. And supposedly that was like a diagnosis.
Yeah, I think that was I thought it was from Tisha or Tisha, apologies if I'm not pronouncing your name correctly. But yeah, just to read in full, in the 19th century, a disorder called drapetomania was coined, describing enslaved Africans who were seeking freedom. The legacy of survival and what that required still lives in the bones and cells of African Americans. What is the research highlighting if and how the torture in this country and the trauma shows up as residual trauma and may even inform the prevalence of sexual abuse in this community?
Well, I'm really wanting to address that question because there's not enough research. So I'm going to encourage you to do the research and write the book, because this is a chapter in America's history that has been literally taken out of the history books, and has been now on this level denied as a cause of generational trauma. And even in the form of the question, that it implies that it's only traumatized African Americans. Like, the generational experience of white Americans doing this to African Americans as the perpetrator has also been denied, right? So we in this country, the divisiveness and the racism, I certainly don't have an answer to, and I certainly can't address it in the 10 seconds that I have to answer your question, but I wanted to honor it and give it voice and recognize that you asked the question, and also agree with you that yes, this is our history. This is our birth story of America. This is the country that we live in, and how it began on the backs of slaves, on the backs of African Americans. And the piece that you're adding that most people don't know is the manipulation of psychology to pathologize the desire to get out of slavery, to pathologize the desire to get out of slavery. Now, I'm not trying to minimize what I'm about to say. I'm trying to minimize what you're saying because of what I'm about to say, but the implications that that has, like to minimize the immigrant experience, that they're escaping from war and poverty and abuse and starvation. We minimize their desire for freedom. They're just coming to America and taking up too much space. They should go back. We minimize the desire for freedom in marriage. No, you should stay together no matter what, because that's what marriage is. It's monogamy. You should stay together forever, regardless. Like, there is something just so fascinating about pathologizing the need for freedom, that there should always be someone in control that has the right to enslave the other person and cause them physical pain and entrapment. And that is the legacy that we are born from. And I don't know what else to say about it other than thank you for bringing it up. And I hope that you will write more about it and talk more about it. You know, as a side note, there's a kink in the BDSM world of the master-slave relationship. And one of the first presentations I ever did at the Networker, the Psychotherapy Networker, a Black woman talked about her master-slave relationship with a white man, where she was the slave in the relationship. And I thought Washington, D.C. was going to collapse around us. It was, you could hear a pin drop in the room. And people were horrified. And it goes to what I was saying before about the fantasy of your worst fears being sexualized and acted out, and the idea of power play and dominant submissive roles. That is a conversation we can't even have, even in the sex therapy world. And, you know, I'm known for a little controversy, you know, so that wasn't a surprise, but I really appreciate you talking about this and bringing it up now. And I would love to have a further conversation with you about it. So please email me.
And also, real quick, wanted to recognize Tassine had also brought up around intergenerational trauma within India and some of the things that have happened there. And so I certainly can read it for you real quick. It's sad that no one talks about the slavery and land grab in India. I know transgenerational trauma that stems from families that were initially royalty and then plunged into destitution once the Brits stole their land. You know, if anyone who speaks to this trauma. So I think to your point, a lot more conversation needs to happen, a lot more understanding needs to happen.
Yes, thank you. Thank you so much for your knowledge and your courage to bring it up.
Let's see. Question here. What about childhood sexual trauma affecting present spousal intimacy and sex?
I mean, I think we've been talking about that for 2 days. I don't know if there's a quick answer. I think the answer is it does affect it. It absolutely does affect it. And there are many ways that we can integrate everything we've learned in the last day and a half to help. The first piece is really establishing a therapeutic relationship. So whether you're asking for yourself, if that's happened to you, or whether you're asking for how to be a good therapist for your clients, you know, it's really creating that space where they can trust you to talk about that. And then you can translate that experience to them trusting their partner. Going back to like the dialogue that I did for integrating Wendy Maltz's work, that's a really good dialogue to do with couples around childhood sexual abuse. And there's a lot of other work. And, you know, I'm happy to send you some referrals for people either to do consulting or to send your clients to.
Yeah. I know we're coming up on the break. Just real quick, or wanted to bring this one forward as well. Questions around birth trauma, even infertility trauma, you know, how that affects the sexual relationship. Just wanted to bring those topics forward and
Yes.
see if you have guidance, thoughts.
Thank you. Yeah, we talked a little bit about like chronic illness and cancer. And yesterday we were talking about the the medications and chemo and stuff. We have not talked about the trauma of birth, which nobody talks about because it's so expected. Like we have this expectation, like, yeah, giving birth is going to be difficult. It's going to be painful. It's going to be traumatic. And, women used to do it in the field. So, you just drop that kid and you move on and you'll forget about it. Wow. Like I have had two very traumatic births and the trauma lasts a long time. And not to mention the physical trauma that it can do to your body and the trauma it can do to your partner if they're in the room, because every partner's in the room now. And we don't talk about it enough. And then the other thing we don't talk about too is that people are having children later and later in life. And so there's more and more egg freezing and more IVF. And the process of IVF, infertility treatments, what that does to your sex life, and that they should have mandatory sex therapy along with IVF. I mean, it's expensive enough. You might as well throw in a little bit more money and get some sex therapy because it does wreak havoc on your emotional intimacy and your sexual relationship. So thank you for bringing that up. In a longer training, we would focus more on those specific issues, but we definitely had to bring them into the conversation. So thank you. Hi. I'm just reading a little bit of the comments. They're so great. One of the questions is about being molested by women. I'm assuming women to men or women to women. There's a lot of specificity around sexual abuse, if it's from your mother or sexual abuse by a mother. There's a great book by Hani Maletsky. There's also one about mothers molesting their sons by Joe Court. I can give you those resources as well. And before we do some art therapy, I just want to show you how to close out a session. This is a couple who's in the midst of grief and trauma. And this is a couple sessions in, and this is the last 10 minutes of a session. It's at different points in their relationship. And what we grieve is the vision that we thought we had of where we were going to be at this point in our lives. I thought I was going to be this person in this relationship, and I thought you were going to be this other person, and I thought we were going to be at this place, and I thought this was the road we were down, and we were going here, and instead we're here. And so there's another letting go of like the acceptance of, well, this is where we are. And then the next phase is, okay, well, how do we create a new vision for a new path going forward? And you can't really control that either. Like, you don't really know. You can put some boundaries in there and things that you would like, some intentions, but you don't know what's going to happen. You don't know what's going to happen in Switzerland. You don't know what's going to really happen with a volcano. Like, there's only so much you can control, right? And, there's fires and there's reminders all the time that we can have a vision for what we want and it can go a lot.
Right. Yeah.
They had a plan to travel. There's something they're doing with assisted suicide of a family member, but they were not sure they could do it because there was an active volcano where they were going.
I think what I hear you saying of having a sense of responsibility and duty and loyalty and surrendering and relinquishing and letting go, for me, it's literally this, like, and I do say, God, I'm out of good ideas here. Show me, show me how to be. And what I know from Mark's mom, Mark's dad, my sons, and my husband is they all want me to be more tender and more, I mean, who doesn't, right? So I had a spasm of tenderness with your dad yesterday, and it got to a point where he was saying some things that I wanted you to be aware of, and you did your leaving the room thing. And that's why when you came back in, I said, please either be a part of this conversation or don't, because he was talking to me and you chimed in and then you left. So I guess that's what I would ask for support from you, Mark, is your presence as much as you can in those moments, not just the telling your dad what to do, but then kind of I don't know. I think clarity is kindness.
Well,
And
that's, yeah. Clarity is kindness.
yeah, and the letter you wrote them and the financial thing is a little unclear, and the party thing, and I don't want to do this twice, but I don't want to do it for both of you. It's a little unclear, and I just sometimes have that empathic response. If I were your parents, I think I would be confused too. So what I'm most wanting you to hear is, I know you want me to be tender.
So that's what I had asked them as we were closing. You know, what is it that you most want your partner to hear from today?
And approachable and present and patient. And I want you to be present and feel all your feelings. And I want to create safety in the space between so that you can come toward me with your concerns or with your ideas and not feel so concerned that I'm going to react poorly to something that you talk to a whole bunch of other people and then tell me, and already have that fear of how I'm going to respond, which is what happened with the medication thing. You know, like, I'm your best friend and I'm your lover and your partner and your biggest cheerleader. And I know you're used to supporting me. And I'm often asking, like, what does support look like for you? And
I'm
I'm
figuring that out. Like,
I know.
now that there's something that I really have to figure out, I'm like, and like, it feels like it, you know, tends to be relatively straightforward for me. Right now, it just doesn't feel that way. I don't, you know, there's not a navigational chart, you know, to sort of look at except like here, I guess, is the only place that I really feel some of that. And it's confusing and it's heartbreaking and it's intense. And sometimes like I said, it'll happen. I just break into tears. And it might last 30 seconds. It might last 5 seconds. And sometimes I'm all by myself and I just have it. And sometimes I'm sitting next to you. So it is, it's all that.
Yeah, I think grief bursts happen. And I think you are open and willing to hear from your good friend who was here this weekend, who said, I just had a great massage. Here's the name and number. I'm going to put in a good word and get you on this guy's schedule. And you asked me to pick up Toby tonight after my clients, and I'll do that. And you'll go get a massage. And you're already hydrating wildly and doing vitamin C for your trip. And
So we were talking about how they could support each other in their healing.
I trust you, and we'll figure this out. We're going to get through this.
Yeah.
We haven't come this far to freak out now.
No, this is a turning point. It's not an end point.
Right. Yeah, I like that.
So Amy, I know you were saying, you know, why does this session, just like every other time, have to be about his parents? How are you feeling about that now? I mean, the reality is this is where you guys are now.
Right. Yeah, I guess I started to feel the fluttering in my heart when we were talking about kind of the lack of spiritual processing around this, or even a memorial or a funeral or a prayer, like somebody coming in. There's no church to support us, even though we all used to go to the UU church in Port Townsend. Like, there's a little uneasiness there, and now it's in my belly, and I'm just kind of like, oh.
So we've been talking about, like, when you talk about your feelings, where do you feel them in your stomach? So this is how, as we move on through different traumas, how do couples become more connected in their trauma language? How do they recognize each other's needs? How do they focus on each other's self-care?
It's with all of us. It's with Mark and the boys.
That's cool.
And it's 10 days of silence. And so when I get caught in the analysis paralysis right now of what are we doing to acknowledge this big rite of passage, it's like, maybe it's just sit in silence together on a lake. Vulnerable right now.
What's your takeaway from today, Mark? I ask everyone, what is your takeaway from today? Or where are you right now as we end?
Well, I'm appreciating just the like if it were a lake, it's pretty calm. I can't really see below the surface, but it's not rough water right at the moment. It feels reflective. Sorry.
Why are you apologizing?
It just feels like a bad dad joke or pun or something.
It's okay.
Sweet? Okay. So keeping that in mind, that this is how, these are some special ways that you can end the session. Like if you focus on like how you feel in your body, what is your takeaway, what is a self-care for yourself and for your partner. Sometimes if I'm working with people that are very actively in their trauma, I use alternative communication methods. So we're going to stick with this client for a minute, these clients for a minute, as I go through some art therapy interventions, which I think are good for people who are highly traumatized, because the materials can be actively expressive without being threatening. I do want to say that these interventions and modalities may be beyond the authorized practice of some mental health professionals. In other words, you're responsible for reviewing your scope of practice under your license. And there might be boundaries of practice in accordance with and in compliance with your professional standards. So this doesn't make you an art therapist, in other words. I just want you to revisit your intention from the beginning of the day and what you were intending to feel, what you were visualizing, what you wanted to experience. The day is not over, but I want you to, we have about an hour, and I want you to revisit that. Has that changed? Do you want to modify it? Is there anything you want to add? How have you interfered or challenged that intention? Are you accomplishing what you want to accomplish? And I want to remind you that there is no normal when it comes to sexuality, healing. I love all the questions about, how do you integrate healing into adult sexual relationships? And there is no book that says this is the one kind of sex they should have. So I just want to, repeat, normal is the setting on the washing machine. It doesn't really mean a lot. And you need to help people set the intentions for themselves. What does healthy sexuality look like for you in your relationship? And what this does is we are looking at this from a biopsychosocial approach. It's a very holistic. So it's individualized to the client's needs, but it also takes into account that we store the pain and in our bodies, and that the emotional pain is differently accessed for everyone and differently expressed. It's differently accessed and differently expressed, and that we honor that it's painful, and that people have a different journey around the meaning of sex. Remember this exercise, that the narrative of the meaning of sex is different for everyone. So it may mean intimacy, it may mean connection, it may mean pleasure in our bodies, it may mean I'm healed from my trauma. Keep in mind that your meaning around what sex means is different than your client's meaning of sex. Keep in mind, remember that we talked 11 people be diagnosed with PTSD. Let me just go back to this. Hold on one second. Having some weird internet fuzz. Something's weird is happening. Okay, it's fixed. Says I had a bad connection. Okay, it's fixed. Yeah, so remember what's unique about PTSD is the flashbacks, the avoidance, the detachment, the shame, the survivor guilt, and the hypervigilance. So how come I'm the one that survived the earthquake? How come I'm the one that isn't totally damaged by that? How come I'm the only one that has a relationship with a partner? And then maybe my partner doesn't really want to be with me. Maybe this is a fake relationship. Maybe I really don't have a relationship. Now we're talking about the recovery stages, right? We've gone through the crisis, we've gone through the insight, we've worked with some of the denial. Art therapy can help with the denial too, and the immediate and the crisis, but we're looking at how do you keep people, even people who are treatment resistant, depending on themselves for taking home some skills that might be transitional, but also might be for long-term recovery. You know, depending on the event, the treatment is individualized, but it depends on, you know, what happened to you, how it happened, how that PTSD is going to terminate in your system. So, you know, trying to determine like who should you do art with? Are they more on the dissociative end of the spectrum? Do they struggle with really intense emotion? Are they cutting themselves or being hypersexual, compulsively sexual? Do they either need or create really protective boundaries around themselves? One of the things that determines that is if you ask someone like, how are you doing? Fine. What's going on? Nothing. I mean, that sounds like you're talking to an adolescent, but sometimes that could be a symptom of trauma as well. Like, are you okay? Yes. Do you want to talk? No. Why are you here in therapy? So you can fix me. Like that sort of shut down protective boundary that serves the purpose of keeping the pain away, not just from you, but from themselves. So that it's compartmentalized somewhere inside. And if I start to talk, then the gusher will begin and I won't be able to put it back in. If someone is having a lot of triggers or flashbacks, different than being activated, right? We talked about that in the very beginning yesterday. If you're activated by intense emotions, good. I was activated several times during the last 2 days. This is an emotional topic. You should be activated. You should be human. You should have intense responses to this. This is an intense topic. This is an intense time. This is a hard job. This is a very hard job. And if you're doing it with couples, it's even harder. Doing couples work is the hardest work you'll ever do because you're set up from the beginning with that trauma triangle. And we don't have enough training in couples work. And it brings up all our relationship stuff. It's really hard. So if you have someone that seems sort of disorganized or they really desperately want help and being in the session is not enough, they might be a good candidate for more creative intervention. Or if they are in that addiction space that Good Mormon talks about, that we talked about a while back, that is not just a passion, you know, like I'm so passionate and alive and I like to dance and I can have a glass of champagne and it's all part of my celebration of life, versus I am going to eat myself up alive with my addiction. Art can be a way to process some of that overflow, that excess overflow of intensity. Picasso said sex and art are the same thing. The idea of passion, of expressing your passion, so that it doesn't become compulsive, so it doesn't become a fire that consumes you, so that it doesn't become overwhelming. I don't know if Picasso is the greatest person to quote here because he had a baby when he was like 92. So he was a pretty a pretty sexual person. I don't know if he was hypersexual or if he just had a lot of partners and he liked younger women. I can't I can't diagnose him because he's not in front of us. I can look at some of his artwork and I can make some assumptions, but that's another class. So I'm going to give you some interventions. I'll give you a little background. I'll tell you about the background of art therapy, and then I'm going to explain to you my concept of art therapy, which I call active. And you can take what you need and leave the rest. You can practice it today. You can practice it with your clients. So art therapy is about healing and growth, and it's also a journey. I suggest that everyone gets a journal, but that has no lines. And that you journal not like, today I went to a workshop. We talked about trauma. I had a sandwich for lunch, and then I had 2 cups of coffee. Tonight I'm going to have a beer. The radio's on. I'm mad at my spouse. If you do that every day, you'll get bored of journaling. It's just not going to work. But if you instead take a big red crayon and write, "I'm so pissed," and that's your journal entry for today, then you're much more likely to tomorrow maybe cut out a picture in a magazine, if anyone gets magazines anymore, of a place that you really want to go to on vacation, and you glue it in and maybe write a story underneath about, this is really what my partner and I need to heal. Doing a scrapbook of your feelings, you're much more likely to expand on your emotional states. It can also be a vision board, like the things that you would like to feel, your intentions. It's great to do as a therapist so that you can do discharge at the end of the day, that chaotic discharge of like, what am I feeling now? Can I please get rid of it? Julia Cameron wrote The Way, The Artist's Way. And she said that everyone should write 2 morning pages when you wake up. Just write. Like, I don't know what I'm writing. This is stupid. I'm still tired. I'm not out of bed yet. I really need coffee. I don't know what I have to do today. I'm really mad still at my spouse. I really want to go to Hawaii, whatever it is. And then throw it out. Don't even read it. Because that chaotic discharge will open up a path of creativity to let you write other things. I did that for a long time. It helped me write some of my books, actually, because it got the mess out of the way. And then you can access those parts of your brain that have the information that are more creative. She does it with actors. She does it with artists. She does it with writers. It's called The Artist's Way if you want to get the book. But art therapy is the use of art, any kind of art, writing, drawing, painting, as a form of therapy for people experiencing trauma, illness, you just want to personally develop, or it can be a way of just getting through the day if you're struggling with day-to-day stuff. The important piece is that it's visual and sensory. Now, the benefit of this with trauma is it accesses memories and lets us disclose them, especially trauma memories that tend to not have language to them. So the way that we recall memory is not like a typewriter. I guess I'm dating myself. It's not like a laptop where you're typing words and they're going by in your brain. We store memory in visionary, in images, in smells, it's stored in a totally different part of our neurological system. So then when we try to recall it, words do not do it justice. And in fact, we may be blocking our access to explaining a violation, or explaining our shame, or explaining how we escaped or got lost or were found again, or, again, explain to me your trauma. Well, I fell out of a boat when I was a kid and almost drowned. That doesn't explain any of the trauma that's stored in your body, the experience, the fear of swimming, the experience of almost drowning, being under the water, how it's affecting you today. Like, there's so much trauma that's stored as implicit memory, which is a sensory body-based form of memory. It's not the same as conscious narrative memory, which is what we usually think of as memory. It happened when I was 10, my father did this, my mother did this, my grandmother did this, but this is what happened next. It's a sensory body-based memory, which is why it helps to get in your body, and it also helps to access music, dance. Sound and body-based approaches are a lot of times used to access implicit memory, but can overwhelm clients. So art gives you a certain amount of distance and control, because it provides, famously, it's providing containment. So if I give you a piece of paper to draw that experience of drowning, now it's within a box and it's over here. So it's on the table between us. So now you're telling me about the art. You're not telling me about the drowning. And so it's in your brain, it's a little safer. Art can also help clients who are struggling with alexithymia, right? That inability to express feelings or words. And it can be a transitional space. So I can tell you what happened in this drawing. Do you see this, little person in the corner? So one of the biggest diagnostic tools of art therapy is house tree person, or draw your family, or draw a house, or draw your family at dinner time. And the reason that is so diagnostic is because if you're drawing yourself in a little tiny, tiny corner and your father is this big and he's taking up the whole page, well, now we can see a lot about what your childhood was like. I have couples sometimes draw together on a piece of paper and they fight over like who's taking up the most space, who's got the most color. It ends up looking sort of like underwater imagery. And then sometimes like one will draw a shark that's coming at the other one. And then they can talk about the drawing. And instead of arguing between them, they can talk about, did you see you almost ate me on that piece of paper? And look how much space you took up. And then we can talk about, yeah, isn't that interesting that you took up all that space? Part of my training is with dissociative identity disorder. I shared that with you earlier. And so this is a way for them to bypass that order to don't tell anyone. And they have these alter or smaller personalities inside that are really preventing the disclosure. So when they attempt to report memories verbally, there can be punishment, there could be self-harm, but art seems to be a way to bypass around those protective parts. And there was a study Kathy Malchiati did where she said that neurological researchers think that a possible cause for PTSD may be the exclusion of trauma memories from the explicit memory storage. And that art can be a way to provide a bridge between implicit and explicit memory. I also think that's why ketamine therapy works, because ketamine therapy is a way to reconsolidate your memories. So it's almost like all your memories and your experience are like reshuffling around and going back into different filing cabinets. And then you can reevaluate the meaning of those memories. Well, the same thing happens in art many times. Like, oh, well, now I have a different narrative about falling off that boat because I have a drawing of the boat and I have a shark underneath the water in the drawing. And now it makes sense why I was so afraid. Because I was a little kid and I had just watched Jaws and I thought, oh my God, I'm going to get eaten and no one's going to rescue me. I'm like floating to the bottom and no one's trying to rescue me. My parents are up in the boat and everyone's fishing and no one knows that I fell off the boat. Of course I was terrified. So now we've reconsolidated that memory. Art therapy in the research also says that it uncovers unconscious material. Now we have a product that we have, therapeutic material to work with. And so people can talk about the abuse without talking about the abuse. Now, this can be overly disclosing for some people, like, oh shit, I didn't mean to draw that. Well, now they can crumple it up and throw it away. Don't get protective about it. Don't get, overly ownership about it. It's their art. And so if they want to take it home, let them take it home. It's really a process. It's not about the product. It's about the process of drawing it. It's about the process of revealing it. It's about the process of talking about it. It's not art that you're going to hang on the refrigerator. Although it really does almost provide that same kind of attachment, like, wow, this drawing is really impactful to me, and I'm really looking at it. I'm really checking it out. Well, that feels like a parent going, wow, you did this drawing. I'm gonna really appreciate this, and I'm gonna hang it on the fridge. I'm gonna save this forever in the attic. There's something to that. It really attaches some meaning around early needs from when you were a child. According to the American Art Therapy Association, art therapy is the use of art as a form of psychotherapy. And they even include the definition for people experiencing trauma or illness. So just to take note that it is a really powerful way of doing it. So Margaret Naumburg, she started the conversation around art therapy way back in the 1940s. And she started referring to her work as art therapy. She was an artist, and she thought that art could release the unconscious. So she was a psychoanalyst, and a lot of art therapy, the roots are in psychoanalysis. My program was about Jungian analysis and interpretation of symbols, so that art therapy is like dream work. So the resulting artwork is like the symbols, the speech that the therapist can talk to the client about, but the patient interprets it and analyzes it. I can't tell you what your dream symbols mean. You have to decide what your dream symbols mean. So I can say, oh, a shark must mean, that you watch Jaws, but you have to tell me what it represents for you. Maybe Jaws is an older interpretation and you don't even watch Jaws. Like, you have to decide and tell me how it feels to you. We can't put that label on your trauma. And Edith Kramer, she was from Austria. Again, the roots are in psychoanalysis. That's where all the psychoanalysts were back in the 40s in Austria. They were Freudian and then they were Jungian. She came to New York and founded the NYU program. And also there was a program at George Washington University. And then there's one at Lesley in Boston, and then the College of New Rochelle in New York. She really worked with a lot of kids and found that a lot of kids had been abused, and it was coming out in their artwork. And so she created a lot of assessments of how to recognize abuse. Later on, a lot of hospitals and mental health facilities began having art therapy programs. So when I was I was in graduate school, actually, I did an internship at a rehab mental health facility. And they had an art therapy program. I was the art therapist and worked with all the populations. And then I got hired away into a different hospital, higher functioning patients, but more sexual abuse. And they used art therapy not only for sexual abuse, but for addictions and eating disorders. So they used it for assessment as well. So they would call me in to do assessment with people and then ask me to interpret the artwork, which for me was slightly problematic because they could infer a whole diagnosis on one drawing, which I didn't think was relevant enough. I think you have to work with someone a bit before you determine if they've been sexually abused. There's some controversy about, if a kid draws a certain kind of sun over a house, that means the father was abusive. And if the feet look like this could happen. Like, I didn't really believe in that. So we have to be cautious that we don't project our own stuff into people's drawings. One thing I like to do in workshops with couples or with therapists or in trainings or in ketamine retreats, any kind of sex therapy or sexuality retreat or workshop, is to find an object that represents a part of your sexuality. And then what I would ask people, like on a lunch break, to do, and you're welcome to take this intervention, You can ask people to do it like after a session. This could be a home assignment. Find an object that represents a part of your sexuality that you want to keep, and then a second object that represents a part of your sexuality you would like to let go or leave behind. And then they bring it in and explain what it is. Like, for instance, um, here's a feather, and I would like to work on my softness and soften my relationship to my sexuality. What I want to leave behind is my fear. This bug on a leaf represents my my fear that's based on my trauma, and I would like to leave that behind. So people would bring in all these objects in a group, and in the middle of the room, and we would make like a big mandala with all these objects, and people would talk about them. And you can learn so much about how people perceive themselves and their injuries and their strengths, right? Their strengths of who they are and what represents their sexuality. You know, people would forget and they'd run outside and get a rock, and this rock represents my sexuality because it's strong, it has sharp edges. I mean, it's really a projective technique. And it's a great homework assignment as well. So I, back in the early 90s, created this active treatment plan. So you're welcome to take any of it and apply it in the context that works for you. It uses art, movement, mindfulness, and writing to treat sex and relationship dysfunction. And each letter stands for something. So A means using art to activate. So if a couple is shut down, if they're numb, if they're dissociative, if they need to be more in their communication, their feelings, if they need to open up, loosen up, have more fun, then you would give them an assignment to activate their intensity. So it might be, this is like painting on their bodies and a painting on a wall, rolling around on each other, rolling around on the wall. They actually are painting with their body. Anything that you use that is loose art material will activate people. Anything you use that's tight material, like colored pencils or crayons, will contain, right? So another way is to use a body map to help couples understand each other's sensitivity. So draw where on the body you're the most sensitive. What turns you on? Where are your erogenous zones? It's not just your genitals. Some people it's behind their knee. Where do you not want to be touched? Where do you love it when I touch you? Where do you want to touch me? Like, drawing with different colors on a body map is helpful. I don't like to do body tracings. They used to have people lie on the floor and then we would trace their body. That brings up a lot of body image stuff because you end up looking not at all like a real body. And people would go, God, is that the way I look? I look weird. I don't recommend that. C is for containment. So a mandala is a round circle that you draw on a piece of paper and then they fill it in from the center out. Carl Jung worked with Freud, and then he split off after they had a disagreement about sort of the collective unconscious and their spiritual beliefs. And he wrote in his journal every day a mandala. He would write and then he would draw a mandala and he would fill it in. It's basically a round circle. And he drew images from his dreams and images from his unconscious. And then later on, he looked back on his journal and he said he could tell exactly when he was going to break it off with Freud by looking at his art. And so as he continued to do the mandala, he watched his artwork to see if he was like getting like sort of psychic visions of things that had not happened yet. And so that was part of his conception of like sort of time is irrelevant. We already know everything. And that he was tapping into this collective unconscious by expressing his imagery. Not just dream imagery, but the artistic imagery that he was creating in his mandalas. Collage, that's weird, like a light bulb just started flashing on and off in my room. Hi, Coral. Collage is also a great way to contain. It's by cutting out magazine pieces and creating an image that's contained on a piece of paper. I used to do collage on boxes, so I'd get like cigar boxes or just small boxes, and I'd have them collage. What do you show people on the outside, and what is hidden on the inside? And so the containment of that, like, this is what I have on the inside, but this is how I show that everything's rosy and wonderful on the outside. And then you'd open it up and you'd see the darkness or the fear. And it's a great way for them to recognize, wow, this is what I'm containing. This is the stuff I'm trying to hold in. Vision boards, I do goddess retreats every year, which are retreats just for women, where we do vision boards that we use words or images from magazines, and we very intentionally create a vision for the next year. So it's not just for trauma. Anybody can do it. I suggest it highly. It's very healing, and it's helped me tremendously. I've been doing it for about 15 years with a group of very powerful women. So I think that helps to have a support system that you do together, and you all channel sort of that energy into it. And then you share the vision board with each other. But using art can, help out of control emotions. So when people are having intense affect, behaviors that are related to trauma and sex that feel like they don't have the space, or there's too much of me, I'm too much, I'm going to overwhelm you, I can't express myself in front of my partner because I overwhelm them. This is a great way to find places to contain that. This is an Israeli sculptor who, these are all different relationship moods, if you will, the back to back, the distancing. I would have people like project, like, what is this couple thinking? What are they arguing about? What are they talking about? What's happening between them? What's going on in this relationship? And you can use it as like a projective technique. So you can have images already cut out or already in your office or a board or something, and say, if you had to make something up about this, what story would you tell? And that's a projective technique because it's most likely not about this, because you and I could both look at this and say something totally different, right? And it wouldn't be about the art, it would be about us. This just says, Edmund, I'm emotionally unavailable. She's in the middle of painting. The T in treatment and active is for treatment, is where art is really used very specifically to intervene with depression or specific symptoms of trauma. So write about your depression, journal about the trauma memory, write morning pages, or here's a worksheet. Here's a worksheet I'm going to give you. It's a drawing of a mandala. Fill this out. Or write me poetry. I'm going to write I am 20 times on this piece of paper, and you can fill this out tonight. Or I want you to write I am 20 times and then fill it out without stopping. We would have poetry slams where they would read what they just wrote, I am, or I am from, or I am going through, or you could give them any sentence stem, and just as long as it's spontaneous and you just write out whatever's unconscious. A moth is where you tell a story within 7 minutes with no notes. Treatment also helps, like if you give people big pieces of paper that they can crush, it helps with rage or anger. If they need more expression and loosening up, giving them looser materials, pastels, any drippy thing like watercolors. I wouldn't give people finger paints because they're very regressive. And unless you're an art therapist or you're really prepared for people to regress to their childhood, you have to be careful what people do on their own or in your office. And again, the body tracings I'm not crazy about, but these are specific treatment interventions. This is a Munch, from the Munch painting, and it says down here, he overreacts to everything. They're in marriage counseling. Okay, I is for integration. So art is used for remembering the dismembered parts of the self. So remember Gina Ogden's 4D wheel, like what does sex mean to you emotionally, physically, spiritually, and psychologically? Mind, body, spirit, emotion, past, present, future. You know, what are the stories we make up about sex? What do they mean about our partners? Or what do we make up about their affairs? What are our ancestors' stories? What do our parents think about sex? How has that affected us? You know, all these layers can be integrated into artwork and memory work. So integration is where you begin to open up those compartments and remember them and integrate them into the understanding of the self. So whether you're writing about them, drawing about them, you know, what represents your mother's sexuality? What represents your parents' relationship? What does sex mean to you? Draw a picture. Like all of those things can be done in a session. You know, you can just keep paper and colored pencils in your office on your coffee table and let people pick it up if they feel like it. Let them doodle. You can doodle while you're talking to people, especially if you're on Zoom. Send them colored paper and pencils. It's a great transitional object. And say, you know, let's both just draw while we're talking. And then you can ask them specifically, can you draw about your vision of your most positive future? If you weren't afraid, what would you imagine? This is a sculpture from Burning Man. And it's, I don't know if you can see it here. This is in the smoke, the dust. This is two adults that are back to back with their inner child reaching out to each other. It's kind of famous by now, but it's just beautiful. And I think from an art therapy perspective, it's so powerful. It says so much. And the reason that it became so popular is because it's a feeling that we can all relate to. It's a feeling that we can all relate to. Here are these little inner children, traumatized, just want to be connected to each other. They don't care about the grown-up bullshit of what we're arguing about. They just love each other. It's just so precious. I forget the guy's name. He's Russian. Did I have his name listed? It got cut off in the slide, but I have it in the resource section. It's really, I think it's one of the most successful sculptures from any Burning Man. Oh, here it is. Yeah, it's called Love, and it's by Alexander Milov, who's Ukrainian, which also is interesting. So he put those two wireframe adults, and you have to see that the size of this is really astronomical. You know, a person is like as tall as the foot. So as much as it's hard to get a sense of, like this is a bicycle right here. So you can't get a size of like the majesty of this. This is it lit up at night. And the inner children light up at night, which is beautiful as a metaphor, right? So V in the active plan is for visualization. So it's about creating a vision of your future. It's creating an intention of what healing looks like. It might be creating a new monogamy agreement or a vision of your new sexuality as a healed sexual person, or a new map of your body. You know, what parts are you're connected with, letting go of the frozenness of your body, or a landscape of healing, or in your recovery from trauma, it could be through clay or dance or movement. It's really, this is the part, like in the third part of healing, creating that vision and being an active participant in it. It's not like saying, okay, I'm the therapist and this is what healing will feel like for you. This is what it will look like when you are healed. When you are in America and the land of freedom, you will have all the gold in the streets will be paved, and you will have a job that will take care of you for the next 30 years. Like, this is not blowing smoke. This is, what is your vision of when you arrive? What is arrival going to look like for your healing, for your destination? And how do you express that? Maybe you don't know. And that's what this V is for. It's visualizing, creating your destination where you become an active participant in that. so that your inner healer and your inner wisdom has expression. And then the last part is E for expression. Art choose to talk about fantasies, feelings, communicating, creating sexual empathy. You talk about your eroticism, and you begin to explore your body in ways that feel personal, so that all the parts of the self become active in recovery. So you're integrating now all the parts of you, because you know you can create parts, and get rid of the inner critic, express your fears and your inner voices. So I'm going to give you some directives. I'm going to ask you to do one of them. In trauma healing, sometimes we get very specific. So this might be like I for intervention, or it could fit into a couple of different places. But sometimes I ask them to draw an autobiographical timeline of the traumatic event. So it helps them to differentiate that happened back then, not now. So from the time you were born till now, where did the trauma occur on that line? When did it start and when did it end? So then people can see, oh, this was this part of my life, and I have this much more of my life, and I may have this much more of my life to go. But if the trauma has affected me for this much time, then I ask them to chop up that biographical event by saying what was the course of the trauma. So this is when it first happened. This is when I first told about it. This is when it was first discovered. This is when I began my therapy. This is when I felt like I was starting to heal. This is when I told my partner. And I might feed them those options if they can't sort of identify that themselves. The idea is a timeline of their whole experience, so that they can begin to have an actual time perspective. Because when you're in trauma, it feels like it's always been happening, it always did happen, and it always will happen. So this is a visual representation. If you were to paint or draw what happened, or an aspect of it that you feel comfortable representing, what would it look like? So you don't have to tell me everything that happened, and I certainly don't want you to express everything that happened in this drawing. But if there's a part of it that you feel comfortable representing, what would it look like? And then I asked them to create a title for that. And then on the back, explain the drawing. And that's the written narrative of it. And that it helps integrate emotion and the cognitive part of your brain. And it reduces the distortion that you might have about it. So, you know, I felt like it's been happening my whole life. I felt like they had control of me. I felt like I've been living under that volcano my whole childhood. You know, what actually happened can be contained in that representation. And then I have them change an aspect of the drawing. So not an aspect of the trauma. Like in your imagination, if you could change it, what would you change? Well, that's obvious. I would have it not happen, or I would have the volcano not go off, or I'd have my loved ones not die, or I'd have the person not touch me, but we're not changing the trauma. We don't have control of that, but we could control an aspect of the drawing. What would you change in this drawing? So they did a series of drawings with kids after a 9/11. And they drew one aspect of the trauma. And then they went back and said, okay, if you could change one aspect of it, what would you change? And a lot of the kids like drew sunshine, they added trees, they had friends that they put in the drawing. It gave them like a different perspective, even if it wasn't real that their friends were there or the sun was out. But you could see it changing them in their bodies and in their affect in that moment. It also gave clues to what they needed in the future going forward in order to heal. So that's the check, change protocol, check, change, keep. So it really means draw a timeline, and then draw a trauma image and write about it on the back, and then alter the image somehow, and then recognize what is it about that gives you strength. And then as the therapist, can you recognize what is it that creates an optimistic future when you look at that. What's the optimistic future image? You know, a simple symbol is like a sun, like a round yellow sun with like the little arms. This is from Christine Courtois. Actually, it's adapted. So then, you know, you describe the altered artwork and you describe how they're different. So it gives you a sense of internal control and promotes a sense of, you know, real resiliency. Like, I can make changes in my life. You also are not dissociating when you're focused on making these changes. So I'd like you to take a moment, take out your piece of paper. And I want you to draw a symbol that represents your strength and a symbol that represents your weakness. And then I'd like you to draw a third symbol of how you're feeling right now at the end of this 2-day workshop. So maybe it's a sun. And if you want to expand on this later by doing a collage or colored pencil drawing, I'm happy to look at it if you want to take a picture and send it to me. If you want to do a big sculpture, that would be cool. I'll give you another minute. Okay. So just notice, you know, what your strength and your weaknesses and how they interweave with how you're feeling now. Another suggestion sometimes I give people is like draw a sexual coat of arms, like draw your values, your traits. How does this affect your sexuality? The reason I do that is because, you know, that coat of arms that is on a shield. And it also integrates your lineage, your past, your history. And that's important because we're integrating the generations that have come before you. It's not just you. It's allowing for a larger picture of integration. It's a kind of corny image, but some people like it. Now, be aware that the drawings that you chose about yourself, those symbols, may be a little bit of countertransference. In other words, you might be like, this is stupid. I'm not doing this. And so you might have just like drawn an X, or you might have just gone and got a cup of coffee. Or you might have regressed and been like, oh my God, I haven't drawn since I was in 3rd grade. And then judged your drawing because it probably looks like a 3rd grader's drawing because you haven't drawn since you were in 3rd grade. It might have activated some fear in you. Just notice it. Oh, just notice it. Notice that we have a bias about art in our culture. If you ask kids in 3rd grade, are you an artist? Every kid will raise their hand. After 3rd grade, if you ask, are you an artist? Only 2 or 3 kids will raise their hand. Because we teach kids that you're only an artist if you can draw a horse that looks like a horse. So my favorite and my last one before we end is draw an image of what an optimistic future would look like. Now that's not like Susie Sunshine. It's creating a vision, right? It's creating an intention. So draw an image of what your future would look like. And try not to be judgmental of yourself or other people. Gabor Mate said, when I'm sharply judgmental of any other person, it's because I see them, a sense of myself reflected in them that I don't want to acknowledge. This says, mind if I take a moment to check with my sex therapist? It's just a sex therapist joke. that I like to end with. So I want to thank you all for being patient with me and for doing the work of the art therapy. And I'm going to take 15 minutes of questions and then we're going to end exactly on time because I'm a stickler for time and I am so appreciative of all of your time. So thank you. Thank you. Thank you. Thank you. Thank you for all your little hearts.
Very good, very nice. All right, so getting to last round of questions. Looking at the most upvoted, so well, I think we slowly will talk through that one. So give me just a minute.
Yeah, take your time.
Okay, here we go. This is from Anna or this afternoon. She said, my question is about porn and partners who are unwilling to change. How do you work with men who grew up with porn, still use it actively when it's affecting their relationship in a negative way?
You know, in heterosexual relationships, I get this a lot. Like couples will come in and the woman will say, I walked in on him masturbating to porn and I feel like he's cheating on me. And he'll say, I've been doing this since I was 10. I don't know what you're talking about. And I would want to ask, you know, is it the masturbation that's the problem for the wife? Is it taking away from their sex life? Is it the imagery that's disturbing that he's looking at? Is it that it feels like, you know, when you got married or committed, you had an implicit assumption about monogamy that, you know, you would be the only one touching his penis and you don't like that he's touching his penis. And maybe you're not touching his penis because you don't feel like it, so he's doing it. Like there's an interesting autonomy issue here about ownership of our sexuality. And then there's another issue around secrecy versus privacy. Should you tell your partner every time you masturbate, whether it's to porn or in the shower, or and is the judgment really about masturbation in general or privacy? Or do you feel like he's being secret about it and he's not telling you? And why isn't he telling you? Because are you shaming him about it or judging him? Or is he looking at something that he doesn't think that you would ever want to do or that he's ashamed about? So there's three reasons that people look at porn. One, masturbatory imagery. It's quick, bam, boom, done. Two, they're looking for things or people or groups or movies of things that they are embarrassed or ashamed or don't think they can get in their relationship. And number three, they are looking at what I call zip code porn, which means they're actually looking to find somebody to meet with to have sex. That's totally different. So you have a lot to unpack there with your clients to figure out what's actually going on. So those are places to start.
Good. Let's see, Susan has a question more from specific to a session I could speak to. So they have couples when there was an affair, the person who was betrayed was turned on talking about the details, wants to talk about it during sex. The partner who had the affair doesn't want to discuss it. It brings up shame and gets turned off sexually.
Mm-hmm. I mean, that's a very specific question. I think they're going to have to revisit their monogamy agreement. Like, what does it mean going forward to be in this relationship sexually, to be monogamous? Sounds like she's trying to use it to integrate into their sex life.
Mm-hmm.
And the person that cheated doesn't want to integrate it into their sex life. They want to compartmentalize it. I don't think you can force that. I think it's a longer conversation about what is our sex life going to look like going forward.
A question from Jessica. How do you deal with healing a relationship system when the partner is the one who has done abuse over years? Giving some examples. How do you work on healing the individual and the system simultaneously? In her example, the client feeling they operated in obligatory sex due to toxic religious messaging and the partner perpetuating this with the same toxic messaging. That kind of give you a frame of what she's asking.
I think that there's been long-term non-consensual sex that the person felt they had to consent to based on their religious backgrounds. And now, for whatever reason, they're in a crisis of realization that this is not the kind of sex life that we want, at least one person.
Mm-hmm.
So they have to go back and rewrite the whole history of their marriage. Like, oh, this is not the kind of intimacy that would have been good for both of us. I'd want to know what kept the person who consented from finding their voice. And what did they need in order to speak up, and why couldn't they speak up? And where did the person who assumed that they wanted that sex get that understanding? Like, where did they learn their gender roles? What do you make up about how couples are supposed to have sex? What did you make up about the meaning of sex for men? What do you make up about the meaning of sex for women? What do you make up about how wives like to have sex? What do you make up about how your wife wants to have sex? What do you make up about how your husband wants to have sex? I would challenge all of that in the session with each other. Like, let them challenge it so that they can start to go, huh, maybe everything we thought and believed is different now. Maybe we're at a different phase of our life. Maybe I didn't really like that, and I didn't know how to tell you. Like, let them figure out how to challenge and have that conversation. You're there to guide them. You don't have to fix them. And that's true for all these questions. Like, it's not your job to fix them, and you can't. So cut yourself some slack. Give yourself a break. Like, it's not our job to fix them. It's only our job to help them communicate about it to each other and help them figure it out for themselves. That's a much bigger job, actually. But it takes some of the pressure off of you.
Next question is really about trauma by institutional caregivers. Clients who have been sexually traumatized by institutional caregivers, counselors, workers, the challenges you had and possibly perceived as a threat.
What that brings up for me is something that we didn't really talk about, which is elder abuse, and how widespread that is, like especially institutional elder abuse. So people in old age homes and retirement facilities. Although I will say that the highest rate of STIs is people in their 80s, and it usually happens in retirement communities because they carry chlamydia and HIV and other STIs that they didn't know they had because they were with a long-term partner, and now they're widowed, and now they're in a community where everyone's having sex. And the people that work there don't ask them about sex and don't provide bowls of condoms in the hallway. They just go, ew, those are old people. And so that's abusive in itself as well, right? To make assumptions about how our sexuality should go away at age 60 or 70, or I don't know what people assume. And then there is, physical abuse and sexual abuse. Any kind of abuse where people are in authority or have power over someone is pretty complicated, right? Because, for all the obvious reasons. And I think things like art therapy are probably good to unpack some of that, because there's probably a whole range of ripple effects that happen around authority. I'm not good with authority. That's why I have a private practice. I can't work for anybody else. All those years ago when I worked for hospitals and institutions, I couldn't wait to get out of there. Not because I felt like they were abusing me, but because I didn't want anyone telling me what to do. And that's because that's my survival skill. So think about someone who was abused in one of those institutions. What is their survival skill now? Like, how does that affect them now? How do they respond to authority? And then do they put their partner in the position of authority? And what are they projecting? And there's so much there to talk about. Oh, Ryan, we just have to do many more days of this.
Gladly, would love to. Little bit of time left. Let's move on to the next question. This is from this morning. When you said, when you were saying that we imagined how the day was going to go, and usually it turns out that way, are you saying that is an approach you would use with a couple that has someone that cheated? They could imagine how their relationship would go from now, and it was likely to end up that way?
I think there's a little bit of confusion of what you're talking about, but I want you to think about like what your intention was for this morning. This is for everybody. How did you participate in making that happen? Did you arrive at the place that you wanted to arrive? Did you create the feeling that you wanted to feel? Did you get more than you thought? Did you get less, and how did you interfere with that? If you felt like I didn't give you what you needed, is there a reason that you didn't ask? Like, how did we contribute to our own destiny? And when in the third phase of visioning, we create a new monogamy agreement or a new agreement in a relationship. Now you can create that any way you want. It's not the agreement that the church told you, or that the government told you, or that your parents told you, or that your culture told you. Now you as a couple get to create it. I can't tell you what your future is going to look like. The two of you get to create a new intention and a new vision of your future, and that you have to both participate in. The more passive you are, the less likely you're going to get what you want. The more active you are, and the more you revisit it, the more likely you're going to be happy. The more implicit you assume that the person agrees with you, the more risk of betrayal. So the more you think, well, of course we're not going to masturbate, like that's not part of monogamy, but you never say it out loud, the more risk there is that you're going to be betrayed, right? But if you talk about it and say, well, where does masturbation fit in our monogamy agreement, the more likely you are to come to an intention that you can agree on. So the more explicit and transparent you can be, the more you write about these things and get really. I have a monogamy toolkit that is like an open monogamy agreement, all the way from very traditional monogamy all the way to like polyamory. And it's a wide range, right? It could mean I never talk to anyone on social media, all the way to we have other partners. So it could mean like that you need to have a conversation about looking at pornography all the time, or it could mean that, you have it once and it's done. But if you need help with that, I have books for that.
Yeah, in terms of the monogamy toolkit, is a good place to locate that. What would you suggest?
I'll send a link.
Okay. Wonderful. Perfect. Scanning through the questions, I think you've covered so much. We talked about, this question on infertility, question on pornography. I think for the most part, we've covered the majority of what's coming in yet.
You want to
Yeah.
tell people about the integrated
Yeah.
relationship?
Let's do that. So to kind of wrap up the day again, just thank you to everyone for joining us through these last 2 days. It's been wonderfully engaged audience. Appreciate all of you, the questions, the engagement, the hearts, all of that. Thank you for being here. Just a reminder, this is one of the core modules of a longer training program, Tammy's Integrative Relational Therapy Certification Program. Lots more information about that in the portal. There'll be some emails followed up to as well regarding that. But just knowing that trauma is so prevalent, so challenging, especially its impact on relationships. We're excited to have Tammy to come here and join us for two days to walk through, to offer this to as many clinicians as possible. So thank you to each of you. Thank you to Tammy for joining us. It's always a pleasure. So grateful to you, and grateful to have also thank you to Tim and the rest of the team in the background. So I think for that, I think we're going to close off our day. Tammy, any final words?
No, thank you, Ryan. As usual, I'm always grateful for you and for allowing me this this platform to have a voice, and to being so patient with my voice. And I love to see your little shy face sometimes smile, roll your eyes when I talk about certain things. It's lovely to be so welcomed, and to be able to expand the conversation. And thank you to Tim and everyone else who's been helping with the technology. And thank you to all of you for sitting for 2 days and being present. And for those of you who are downloading this later, let me know how you do and what you think. And I'm really open to any questions that are not answered on today's call. So thank you. And everybody, stay cool and stay in touch.
All right.